So, in an unenviable position, I'm now chairing myself and speaking at the same time. So I will do my very best not to overrun, but I'm going to ask my co-presenter, James Hamilton, who's the Senior System Transformation Specialist at Smith & Nephew, and we're doing a double act, basically about how our care pathway approach at Sustainable Healthcare Coalition has been applied to their work. So, James, grab a few here.
Okay, thank you.
So this is me. I am Fiona Adshead, you heard about that. And we are the Sustainable Healthcare Coalition. So you heard a bit about the Greener NHS's team's predecessor, the Sustainable Development Unit, and they had the great foresight over 10 years ago of actually realising that if they were going to solve the problem in the NHS of their supply chain, they had to work across the system. They had to bring people together to collaborate and really think about how could we learn together to come up with practical solutions to tackle some of those problems we've already heard. And we've grown in recent years, and we've got a range of companies, both healthcare providers, innovative tech companies, as you heard from Pete, and many of our members, Chris, who you've just heard from, and Smith & Nephew as well. But really, the point that we were set and the challenge that we were set to solve is how do you really get that issue of measurement sorted? We heard a lot about that in the last session. And we started really by thinking about how can we measure the impact of medicines and devices. How could we come up with the first global guidance to measure their impact? And that was what we did as a group. We brought together colleagues in the NHS, in industry, to really think about how could we come up with a consistent method. But obviously, if you do that, products and services in any intervention only makes sense if you think about, well, how does that get applied in practice? How does that sit within the patient's journey, their care pathway? So the next task we set ourselves was to think about care pathways and to think of them, if you like, as almost a set of Lego bricks that you could join together, different activities that you could break down. And we looked at different areas: GP consultation, patient travel, emergency department visits, and really tried to work out what the activities were and what the environmental values were from a carbon, water and waste perspective. And really, all of those added up really give you your care pathway. And at the moment, we're refreshing that approach, particularly for surgery, with colleagues in the Greener NHS team. And we have online a calculator, and we're going to be updating that very soon too, to make it a little bit more accessible. Because as we've heard, making this easy for people is really challenging. But of course, it's no good coming up with metrics if you don't actually apply them in practice and see what happens when you do. And you heard a bit from Chris about how they've applied it, but we've also looked, for example, at how having a smart device helps parents and children adhere to asthma treatment. That was AstraZeneca's work. We've worked with them recently on flu case study. Johnson & Johnson again on actually again how digital support can help the system to really improve outcomes. And we've looked at everything in renal care, which I'll go on to describe a little bit more, particularly around with Baxter, how you could redesign some of their products to make kidney care more sustainable. But at the heart of this really has been a truth which I think we've returned to time and time again in the discussion today, that when I worked in what was then the Department of Health, what I knew was that actually change happened where services are delivered. All the brilliant clinicians and managers and other people who are really thinking about how they want to solve the problems they're encountering every day. And so we've been really fortunate to work with some clinicians who are really driving change, particularly around carbon footprinting of hemodialysis, kidney replacement therapy, with Surin up in Newcastle, and together we've produced our first international calculator looking at the impact of renal hemodialysis. We've worked with Matt Sawyer and colleagues within primary care to look at the non-clinical aspects of carbon and come up with a general practice calculator. And recently, we've been using our case studies to shift towards prevention. With the Academic Health Sciences Network, we looked at one of their new innovations, a diagnostic test for preeclampsia, which could help differentiate when women needed to go into hospital. And that showed that there was a huge cost savings for the NHS, huge improvement, obviously, for women, but very importantly, also reduced environmental impact. And finally, we're daring to go into that other area of Scope 3, research and innovation, because we know that the carbon impact of clinical trials globally is probably the same impact as Belgium as a country, so it's big. And so we're now coming up with colleagues in academia and across industry with a standardized framework to actually help you design a clinical trial. So again, you can design impact out. So this is all about thinking about design and impact. And so at that point, I'm going to hand over to James, who's going to tell you about how they've done that in Smith and Nephew.
Thank you very much.